everybody. Today I am your host, Grace, and we have Helena, Tanda, and Cliff today as our guests. So, our story is about Mary and Josie. Mary and Josie were conjoined twins born in Malton in 2000, physically connected at common, sharing vital blood circulation. Josie was the twin and functional organs, while Mary is survival dependent entirely on Josie. Without this surgical separation, both were expected to die within months. Their case was transferred to the UK for advanced medical care, where the doctors proposed to separate to save Josie's life, leading to the complex ethical and legal debate. Next. In this case of moral dilemma, and why? Yes, this is a moral dilemma. So, firstly, the conflict of moral principle. On one hand, saving Josie means performing the surgery that will inevitably kill Mary. On the other hand, the not operating condemn both twin dies within months. As for the legal and parental belief, parents' refusal. The parents cite their opposed to the sacrificing one child for another. As the moral weight about whether to actively perform the operation caused Mary's death, but saving Josie, or let both die. The court weighs that the welfare of one child against the certain death is both action that has to be taken. The tensions between one life and the other expense, alongside with religious conviction versus a legal duty, expedite the files as classical moral dilemma, whether any choice results to a significant moral case. So, Helena, why does this case involve meta-ethics and consideration?
So next slide. Yeah, before we discuss how the case of Mary and Judy relates to meta-ethics, let's first understand what meta-ethics actually is. Unlike normative ethics, which focuses on what we should do in specific situations, meta-ethics looks deeper. It asks questions like, what do we mean when we say something is right or wrong? Where do our moral values come from? And can moral truths be proven, or are they just based on opinion or belief? So, meta-ethics doesn't deal with making decisions directly. It helps us explore the foundation of moral beliefs and how we justify our ethical positions. Next slide, please. Now, let's connect this to the case of Mary and Jody. This case raises many deep moral questions that go beyond just deciding what to do. First, it questions the meaning of moral rights. Does Mary truly have a right to life if staying alive means Jody must die? Second, it challenges us to think about the source of our moral values. The parents guided by their Catholic faith believe all life is sacred and must be protected. Meanwhile, the doctors and courts are applying ethical reasoning based on the outcome, saving the child who can live independently. Finally, it brings up questions of moral justification. Is it morally acceptable to save one life by ending another? These aren't just ethical questions, they are meta-ethical because they ask us to examine how we define morality itself and where our moral judgments come from.
So, Tandar, if you were a doctor, would you perform medical intervention to separate them even with the risk of death on one of them? What is your moral argument?
Okay, so if I were a doctor, I think I would do the same thing because my moral reasoning is grounded in the principle of choosing the action that gives at least one child the chance to live a full and independent life, rather than allowing both to die without intervention, just like Helena just mentioned. So the medical facts are clear. Mary was entirely dependent on Jody for survival and functioning almost like a parasitic twin. So her organs were under developed and she had no realistic chance of independent life. Meanwhile, Jody's heart was under strain, and without separation, both babies would inevitably die, right? So this is not a case of intentionally killing one to save another. Is it a case of preventing the sudden death of both by saving the one who has a real chance to live? Uh, as the court stated, Mary Ward sucking the lifeblood of Jody and continuing inaction would result in the death of both. So although I acknowledge the profound ethical difficulty, especially like you mentioned in the moral dilemma, especially from a religious or sanctity of life perspective, I believe the morally responsible decision is to save the life that can be saved. The aim is not to devalue Mary's life, but to recognize the harsh medical reality. Her survival depended entirely on Judy, and she was fated for early death regardless, right? So therefore, I agree with the court and the doctor's decision. If I were in their position, I would do the same thing, not out of disregard for Mary's life, but out of a duty to preserve Jody's life, which could flourish in such a tragic dilemma, choosing to save one life, one both are at risk is, I believe, the most ethical path. Yeah.
Thanks. Now that we reached the most emotional and difficult part of the case, the doctor knew that performing the surgery to separate Mary and Josie would be inevitably cause Mary's death. Yet the court still allowed it. So the question is, what was the court reasoning for approving such a heartbreaking decision, Cliff?
There's such a big question to discuss, and this case was truly a painful ethical and legal decision. But the court's reasoning was based on a few key principles that we can identify. So one of the main one was the doctrine of necessity, because in legal terms, this means that sometime, okay, an actions that is not normally allowed, like ending life, can't be like permitted if it is the only way to prevent a greater harm. So in this case, if the doctor did nothing, both Mary and Jody would die within months, right? So, but if they perform surgery and the operation, there might be a chance that Jody could survive and live a normal life.
So the court didn't see it as choosing to kill Mary, but rather choosing to save Josie?
Yes, exactly. The court made it very clear that the intention of the doctors was not to end Mary's life. The goal was to save Jody, right? So Mary's death was an avoidable consequence, not the intention that to kill him. And this fall under what known as the doctrine of double effect. So it's a concept in moral philosophy and ethics that say if an action has both a good and bad effect, it can still be morally acceptable if the bad effect wasn't intended. But
Her right to live?
I think yes, but the medical facts were very clear. Mary had no functioning heart or lungs of her own, so she was completely dependent on Jody for blood and oxygen, right? So some doctors describe her condition as parasitic, meaning that she could not survive independently on her own and was in a way putting Jody's life as a constant risk. So the court considered that Mary was not a viable life in the same sense as Jody. So Jody, even though meanwhile Jody have the ability to live a healthy, independent life, but only if she was separated from Mary.
So the court prioritized Josie's right to live since she has a real chance of survival?
I think that was control to the decisions. The court emphasized that it has a duty to protect life whenever it's possible. Say, if both child would die without intervention, then one would could be saved though through surgery, right? Then preserving that life was considered the most ethical and lawful choice. So it was a tragic decision, but it aimed to reduce the harm, the greater harm, and the loss of life.
Thank you for explaining that so clearly. It's heartbreaking, but I can now understand why the court believed it was the most humane and responsible decision under the circumstances. So that's the end of our talk shows today. Sometimes the hardest decisions are the ones weigh on life against love. And there's no perfect answers, only encouraged to choose. Thank you for listening to our talk show.